Hi everyone. So for this post, I'm going to be talking about the feeding and eating disorders that are the least common. So the least common feeding disorders include pica disorder, rumination disorder syndrome, avoidant restrictive food intake disorder, purging disorder, diabulimia, night eating syndrome, orthorexia nervosa, atypical anorexia nervosa, and other specified feeding or eating disorders. So we're going to start with pica disorder. This is a disorder where one consumes items that are not considered food and do not contain nutritional value, such as dirt, hair, etc. This affects children, adolescents, and adults, and affects both males and females. Some symptoms include persistent eating over a period of at least 1 month of substances that are not food or contain no nutritional value. Um, um, this ingestion is not part of a culturally supported practice. Um, Typically, substances ingested tend to vary with age and availability. Um, this may include paper, soap, cloth, hair, etc. Um, Eating of these substances must be developmentally inappropriate. So, for example, children under the age of 2 years should not be diagnosed with pica due to the fact that it is normal for them to be mouthing objects or putting small objects in their mouth. And for treatment, it's pretty limited, but treatments include behavioral intervention and um, correction of deficiencies. Now we're going to move on to rumination syndrome. It involves regular regurgitation of food at least once a month. The person doesn't typically seem to be making an effort or seem to be disgusted or upset. Some symptoms include repeated regurgitation of food for a period of at least 1 month. The food may be rechewed, reswallowed, or spit out. The repeated regurgitation is not due to a medical condition. Um, this behavior does not occur exclusively in the course of other eating disorders. And if occurring in the presence of another mental disorder, it is severe enough to warrant independent clinical attention. Treatments include the use of habit reversal and breathing exercises, but overall, the treatment is still limited. Now we're going to talk about ARFID. This disorder is characterized by a limited amount and type of food intake. It's not caused by a negative image or desire to change body weight. Some symptoms include significant weight loss, abdominal pain, low body temperature, lethargy, etc. The main treatment for this disorder is cognitive behavioral therapy. Now we're going to talk about purging disorder. It's the use of purging tactics to influence body shape. It's very similar to bulimia, but what differs is the act of binge eating. With purging disorders, they don't typically binge eat, they just eat a normal amount of food and purge right after. Some symptoms include dehydration, organ damage, electrolyte imbalance, dental problems, swelling of throat. And cognitive behavioral therapy is the best type of treatment. Now we're going to talk about diabulimia. This is a type of disorder in which one with type 1 diabetes refuses to take insulin to avoid weight gain, and this can be life-threatening. Some symptoms include unexplained weight loss, dizziness and fainting, electrolyte imbalance, avoiding diabetes-related appointments, fear of low blood sugar episodes due to needing to eat food and to treat them, fear that insulin causes weight gain, etc. And the best kinds of treatments are the use of insulin appropriately and managing blood glucose levels and weight. Now we're going to move on to night eating syndrome. This is typically when a person wakes up several times during the night to eat. Symptoms include waking up in the middle of the night to eat multiple times per night and more than 4 times per week. Eating more than 25% of your daily food intake after dinner and before breakfast. Craving foods that are high in calories, carbohydrates, or sugars at night. Being consciously aware of night eating and being able to recall it during the daytime. skipping breakfast or not eating your first meal until the afternoon, and not being able to function as expected during daytime hours. Treatments include cognitive behavioral therapy, antidepressants, melatonin, or muscle relaxation. Now we're going to talk about orthorexia nervosa. It's a disorder where one becomes fixated on eating healthy to the point where they can become malnourished or have impaired psychosocial functioning. Some symptoms include compulsive checking of ingredient lists and nutrition labels, an increasing concern about the health of ingredients, and cutting out an increasing number of food groups, and an inability to eat anything but a narrow group of foods that are deemed healthy or pure. There are no clinical treatments being developed, but treatments for other eating disorders can help treat this one. Psychotherapy is also shown to have helped with orthorexia. Atypical anorexia nervosa is basically the same thing as anorexia, but the difference is that the weight remains average and not under. Some symptoms include binge eating, eating less and skipping meals, exercising more than you used to and very extreme, feeling anxious or having mood swings, etc. Psychotherapy, medication, and nutrition education are all types of treatments for this disorder. And last but not least, we're going to talk about other specified feeding or eating disorders, or OSFED. It's diagnosed when a person doesn't meet the specific criteria for the main eating disorders, but has a significant eating disorder. Some symptoms include preoccupied with weight, shape, appearance, leading to restriction dieting behaviors to promote weight loss, dramatic weight loss. They're preoccupied with weight, food, calories, fat, grams, and dieting, and refusing to eat certain foods, and often eliminates whole food groups. For treatment, the best option would be meeting with a health and mental health professional. So if you or your loved ones are dealing with eating disorders, I provided hotlines for anorexia nervosa and associated disorders and National Alliance for Eating Disorders hotline. And this concludes the entirety of Feeding and Eating Disorders. Thank you guys so much for sticking around.